A single number on your insurance bill determines whether South Korea thinks you need help, and it's telling millions of people they're wealthier than they believe. When the government opened applications for fuel subsidies on May 18, administrative centers across the country became stages for an uncomfortable revelation. People who'd driven across town expecting relief payments were turned away, told their monthly health insurance premiums exceeded the cutoff. The confusion wasn't about eligibility rules, it was about identity. These weren't wealthy people. They were civil servants, teachers, small business owners who considered themselves squarely middle class. Now they were being classified as the top 30%. The mechanism is brutally simple. South Korea is distributing 4.8 trillion won in oil price relief to the bottom 70% of income earners, roughly 32.56 million people, to offset fuel costs driven by the Middle East conflict. To determine who qualifies, the government uses health insurance premiums as a proxy for income. In South Korea's national health system, premiums scale with earnings. If your household pays more than approximately 350,000 won per month in premiums, you're statistically in the top 30%, and you're ineligible. The problem is that many people in that bracket earn around 5 million won annually, hardly affluent by Seoul standards, but enough to disqualify them. What makes this sting is the gap between self-perception and statistical reality. Income distributions are invisible to most people. You know what you earn, what you spend, and how tight your budget feels. You don't know that 70% of your countrymen earn less than you do. When a government clerk tells you that you're in the top third, it doesn't feel like validation, it feels like a miscalculation. The phrase bottom 70% has become a flashpoint in Korean media precisely because it forces people to confront where they actually sit. A column in the Korea Jingang Daily in April captured the dissonance. Middle-class taxpayers find themselves squeezed between non-taxpayers and the affluent, paying into systems that increasingly exclude them from benefits. The wasted trips are a symptom of a deeper design flaw. Health insurance premiums are a reasonable proxy for income at the population level, but they're a blunt instrument for individual cases. A retiree with a pension and owned home may have low premiums but substantial assets. A young family with 2 earners and high premiums may be drowning in debt. The metric doesn't see financial stress, it sees a number. And once that number crosses the threshold, the door closes. Over 70% of eligible applicants submitted claims within 4 days of the first round in late April, according to the Korea Jingang Daily. But that also means millions didn't apply, either because they knew they'd be rejected or because they didn't realize they qualified. The confusion runs both ways. This isn't just about $400 in fuel subsidies. It's about the political economy of mass relief programs in a country where inflation is squeezing the middle and the government is trying to stabilize prices without blowing the budget. The supplementary budget, 26.2 trillion won, was passed in April as a war budget to manage the fallout from oil shocks. Targeting the bottom 70% was a political compromise, broad enough to feel universal, narrow enough to be fiscally defensible. But the execution has revealed the cost of that compromise. When you draw a line through a population and tell 30% they're too rich to need help, you'd better be sure the line is drawn where people expect it to be. In South Korea this spring, it wasn't. The second round of applications continues through July, and the government has not adjusted the eligibility formula. The line stays where it is. The people just above it are learning something uncomfortable. Being in the top 30% doesn't mean you're wealthy. It just means you're less poor than most. And in an economy where fuel costs are climbing and wages aren't, that distinction doesn't buy much relief.